Coming up next on Being Well, we'll be talking about workplace injury and prevention. Our guest is family nurse practitioner Tiffany Turner from Paris Community Hospital Family Medical Center. We'll learn more about common workplace injuries in industry, agriculture, and the office. We've got that and the latest medical news just ahead, so don't go away. Being Well starts right now. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. I'm here with Tiffany Turner, family nurse practitioner with Paris Community Hospital Family Medical Center. Thanks for joining us.
Thank you for having us.
Well, today we're talking about workplace injury, which is your specialty over at the Paris Community Hospital. Tell us how you got involved in that area of medicine.
Well, there's a huge industry in this area that really needs to be targeted and addressed on a consistent basis. So what I do is I look at, I came in and we recognized that that was an area of need for this area. So what we did is we just took the initiative. It's one of the things that the industries in this area have been asking for quite some time. And we listened to what the industries were requiring, and I had previous work comp experience. So they brought me in to kind of get this program started and to be a consistent provider for the area.
So how does it work when someone comes in to see you? Maybe they strain their back at work. What kind of process do you go through with them?
Well, depending on what the company wants is one of the guiding factors. So if the company wants them to have a drug screen, if they want them to have a breath alcohol, we will do those types of things. But that's all based company by company. Then what happens is we actually do a physical assessment on them. We bring them back, we check their vitals, we will touch them, push, pull, poke, do whatever we have to do to determine what the injury is. Then we'll do a diagnosis. We prescribe medicine. We would treat them very similarly to what their family physician would do. But the main focus is to make sure that they get back to work and that they are back at work doing what they need to do in a very timely manner. And the big push is to make sure that they don't lose any work time.
Okay. So when you think about workplace injury, you also think of workman's comp. How do you handle that in your job?
Well, workman's comp is typically provided by the industry. So if they are injured at work, they are a workman's compensation claim. Some of the industries are self-pay, and so what that means, they're the self-insured, and so what that means is that they will pick that bill up and they don't have to turn it into their insurance company.
Okay.
Some of them from the get-go turn it right into their insurance company and file a claim. And what that will do, it's no different. We treat them the same, we take care of them the same way. It's just a different method of payment.
And so when you're treating them, are you the one that kind of gives the recommendation as to when they can go back to work?
Yes.
Does that come from you?
Yes. And you know, you look at some different factors. When they're injured at work, if they don't leave work and they aren't having lost time from work, it's a win-win for the patient as well as for the company. The other big thing is the more that they're at work, the more that they understand that they should be at work, the more that they get paid, actually. They're not going to lose revenue because they're at work. They may have some restrictions, they may have some modified duty, they may have some activity that is not normal for their job duty, but we always look at what their functions are. We look at their job description, we look at their weight limits, we look at different factors of what they will be doing, and we get them back to work based on those restrictions.
So is the limited work duties, is that dependent? That's dependent on the company. Do some companies say they have to come back doing their job and nothing else, or are most companies around here kind of flexible? They want that employee back.
Yes, very few do not have something that they can do.
Okay.
They may move them into an office, they may move them out of their specific job description, but most of the companies here will definitely get them back to work. And the big thing from that, it's not the companies that are being stringent, you know, it's an OSHA law. It is something from, you know, the government. It's not just, hey, we want everybody to be here. So what they are going to do is they're going to bring everybody back in and try to eliminate any lost time, any restrictions that they can.
Okay, so in our area here, based on the kind of industries and farming that we have, what are the most common workplace injuries that you're treating?
You're going to see a lot of different things based on the injury or the industry, themselves. So if they're coming from a glass manufacturer, you're going to see cuts. If they're coming from metal workers, they're going to have cuts. If it's coming from a farming incident, most of the time those are going to be crushes, maybe falls, some major trauma. You know, and with those, if it's major trauma, that's not something that we're going to see in the clinic. That's going to be treated in the emergency room. That may even transfer out to a different facility based on need. The first and foremost thing that we do is we treat the patient accordingly, and we make sure that they're getting appropriate care. Even though that the company is our patient as well as the patient is our patient, ultimately safety and medical care for the patient is the utmost concern. So we, you know, but as far as we see everything, we see a little bit of anything, strains, sprains, you know, ergonomical injuries, all different kinds of things.
So let's talk about kind of the top causes of workplace injuries in the first place. There's some general categories like exertion for one.
If someone's really tired, they're more likely to make mistakes. And there's much research out there that talks about fatigue and the differences, and actually even compared to alcohol impairment. Some of those research studies have basically equated people being fatigued to almost being equivalent to being alcohol intoxicated.
Really?
And so though if they're intoxicated with alcohol or if they're extremely fatigued, the chance of injury obviously is high. So we want to make sure that people are getting enough sleep. There is such a thing called shift work fatigue, and if you are working the night shift and not getting appropriate sleep, those kinds of things, a shift work disorder can be very impairing.
So we also, you know, common falls from up high, you know, which can be very devastating, but just a fall across the floor here is another cause. I
mean, you can just be, something very simple as far as, you know, we get lots of snow in this area. So in the winter time, you're going to see more strains and sprains of ankles and wrists from people trying to catch themselves, back strains from falling hard onto cement, just getting in and out of a car, twisting their ankle on a curb, or, you know, there's lots of different instances where people fall. I mean, just simply somebody had a water bottle that spilled and they didn't see it. You can have severe injury from that as well.
I think sometimes when we think of workplace injury in a factory setting or even in an office setting, you think of anything that's repetitive use injuries. Do you see a lot of those? And
you can. In a factory, some of the factories that don't have a lot of heavy lifting, but they have that repetitive motion of putting parts together, snapping things together. You know, they have high volume, not high weight, so you can see that to occur on a regular basis.
So what are some of the ailments or issues that result from those repetitive use injuries?
You can see some carpal tunnel, some cubital tunnel. One of the things that the safety officers do with those employees where they have high risk rates of cubital and carpal tunnel is they actually do exercises at the start of the shift, and they loosen those joints and those ligaments up in an effort to minimize that problem. That does help. There's also other things that the employee can do, you know, take frequent breaks, make sure that one of the other things is shifting from the different types of workstations. So a lot of the companies or the industries that have repetitive motion and they've had trends of having injury like that, they actually have their employees shift. And so maybe they're only on this station for 2 hours, then they shift to another station and do something different for 2 hours. So those are the types of things that we can look at to make sure that those are happening, so to minimize injury over the long run.
Do you want to talk about, in a lot of companies have a safety officer. As you said, there's always trends and changes in workplace safety to make it so that maybe they don't have to come see you, but that those trends are changing and we're trying to create a safer workplace.
Most of the industries or the larger industries have a safety officer, and what that safety officer does is they actually just look at everything from an out-of-the-box perspective. why are they getting injured. They kind of do a root cause analysis to determine, is there something that we should have done differently? Is there something, do we keep getting injured because we're bending over? Do we keep getting injured because we're sticking our hand in a piece of equipment that isn't safe, that maybe should have a guard on it? Do we get injured because we're being negligent in something? So what that safety officer's role is to basically know every job and to go around and to assess every single component of that job. For instance, where someone may have to push a large weighted object across the floor, instead of bending over to push that object, they may put it on an elevated stand so they're more ergonomically correct. So when they push that, it's with their weight and they're not pushing with their back, but they're using all of their muscles. So those are just simple things that those people have done. Instituting wearing gloves when they're going to be around a lot of shards of metal that could cut them, or around glass products that could cut them. There are specially designed gloves that will protect their hands from being cut. So there's lots of little things that, and then they're the people that kind of hold their employees to the fire to say, did you have your gloves on? Did you have your eyeglasses on? You know, your safety glasses? Did you take the safe precautions? If they're exposed to chemicals, what should they have done differently? And you know, they're the main component of these industries. They're the people that drive their workers to make sure that they're doing things appropriately. That has cut down on a lot of injuries. And then when the injuries are persistent or there's something that need addressed immediately, that's when I see them.
Okay, so what about, you talked about you may treat someone that has a severe cut on their hand. It happened that day. What about somebody that's maybe worked in a certain industry for years and they see there some long-term effects kind of start to, I'm thinking of like if you work in a loud environment, are you things like hearing loss, things that happen slowly over a long period of time?
Well, we do have an audiogram screening program that we can do. So everybody who is in that environment, they should be wearing hearing protection. And most of the time that's required by the facility. But we do annual exams on these people, and we have something called an STS shift. It's a threshold shift of their hearing. And basically year over year, if they have a significant change in the decibel of their hearing, then we can predict that they're going down a wrong path. And it may be because their right ear is always to the machine that's behind them, or something like that. It may be as simple as just having, earwax, but we need to look at those things and kind of address them. So a lot of the companies that have loud equipment, we do annual hearing testing. Also for people who are exposed to a lot of chemicals, we can do, or dust particles, they have a pulmonary function testing. We have a machine that we can take out on site, or they can come to us. It's very portable, and we can do that for them as well.
What about when should people, if they have a workplace injury, if they don't have a nurse maybe in that factory where they're working, when should they come see their healthcare provider? And do you find that a lot of people don't? Just sort of, well, it's fine, I'll be okay.
Sometimes it kind of depends. In the state of Illinois, you can go anywhere. So you don't, where in other states, the company mandates and drives where you go get your health care. In the state of Illinois, they can go to any provider. So they can go to their family physician, they can go to their family doctor and get care. The problem with that becomes, or there's some conflict of interest with that, because of the fact that if they know you, they may say, hey, don't worry about it. You don't have to go back to work today. So then that company is suffering loss. And a lot of times what happens, the longer those people are out of work, the less likely they are to go back to work. And so we want to get them back to work. We want to get them better. And we want to see if there truly are things in their workplace that are causing them injury, we need to fix it so nobody else gets hurt as well. Pretty much people should, they should go when they feel an injury, or at least do what we call a first report. Talking to their HR director, talking to their safety officer to say, I really hurt my back yesterday. I just want you to know, want you to be aware of it. And, if they feel like they need treatment, they need to come then, because the quicker we can get the inflammation out of their system, the better they will feel in a period of time. If you continue to let it linger, it's going to get worse and worse and worse.
So when you are doing some of these exams, maybe someone comes in for a back injury, are you sometimes uncovering other underlying health issues that they maybe didn't know about?
You can actually, you know, you can even find, you know, as severe as cancer. You know, they've had that constant gnawing nag in their back and it was no big deal. I have had a case in the past that we, you know, did diagnose some cancer from that. You can diagnose some high blood pressure problems. You can diagnose some issues with their kidneys that, you know, they thought it was a back strain, but really it was their kidneys that were not functioning appropriately. So it can be a life-changing or a life-saving event, making sure that you get checked out.
Are there other underlying medical conditions that can make workplace injuries or workplace safety can impede that? I'm thinking maybe like high blood pressure, diabetes, and things like that.
Absolutely. A lot of times people are exposed to heat, so the blood pressure is going to go up when they are out there, so they're more predisposed to heat stroke. In addition, if they're not getting their high blood pressure under control, if they're in a very high industry where it has high anxiety and high demands from their job, their blood pressure could be creeping up. If that's not taken care of in a timely fashion, you can actually hurt your kidneys and your liver and actually have some renal disease. So if we get that taken care of early, the patient is going to have minimized healthcare risk and minimized healthcare issues, and the company is going to save money over the long run.
What about for people with diabetes? We know that that's increasing in our populations. What sort of things should diabetics be aware of when they're working in a certain type of industry that may have an effect on their diabetes and their management of it?
Well, there's a lot of different things that they need to look at. First of all, if they are working a long 12-hour shift, they need to make sure that they take adequate breaks, that they're drinking adequate fluid. In addition to that, they could have potential for severe highs or severe lows. And so again, that can cause severe injury. If they're operating heavy machinery and they're having a low episode, they can actually pass out and injure themselves and multiple others. So they need to make sure that they have adequate food sources on hand, that they are aware of what their sugar trends are. In high heat environments, especially as we're hitting summer, they really need to make sure that they're taking in appropriate amounts of water, staying away from the colas and the sodas. And, you know, Gatorade is good, but it does have sugar in it. So if they're going to take that in, they need to know what their blood sugar is doing, because people don't realize sometimes that that has a high content of sugar. There is other, you know, electrolyte replacement drinks that you can utilize too. But again, just making sure that they're aware of their blood sugars and aware of what their body feels like, it can actually, you know, really make a significant difference on the outcome of their day.
Let's talk a little bit about, we're in a agricultural area, so we've got a lot of farmers. I'm thinking of, you know, farmers and truck drivers, people who aren't standing a lot but maybe doing a lot of sitting. What kinds of issues or injuries can they sustain from sustained sitting? You know, when you think about there's planting and harvest season.
There's a lot of different things that can happen from, you know, they are more prone to being obese because they have the capacity to eat snacks while they're driving or sitting in the cab. So we have to look at that. They are more prone to have kidney problems because they don't go to the restroom efficiently and timely, because they're worried about getting their job done and, you know, just pushing it to that next level. Again, fatigue is a big thing. They're out there very long hours. Some of the, you know, the drivers not so much because they have the DOT regulations. But, you know, and then if they're not getting good sleep, they can definitely be fatigued and have, you know, impairments from that. And just the monotonous of just driving down the highway or just being in the field, you can sometimes just zone out a little bit. And so being aware of your environment, you know, being stimulated on a regular basis. A lot of the patients or these people have, you know, kidney problems, they have high blood pressure problems, they have sugar problems from, you know, not adequately eating. So, you know, they might eat in the morning and then never eat again until late at night. So we have to kind of, you know, coddle them a little bit and give them a little bit of help to make sure that they get what they need.
Can they get issues with, because they are sitting and they're not really moving the lower part of their body, issues with numbness, tingling in the legs?
Blood clots are a very key factor that these people experience. Definitely, they, you know, you've rode for long times in the car. You know, that vibration can cause some issues and it can actually, you know, put them to sleep. And, you know, with them driving for a long period of time, if their leg's asleep and they need to stop quickly, that's an issue. So we're really addressing that. And they have to have good peripheral vascular disease. So they need to have good blood return, because if they have a lot of blood that's pooling in their legs from dangling for a high amount of time, we could have some issues there too. So they're not getting good blood supply back to their heart, and it's causing them to have other issues.
We've talked about workplace injuries in industry and in agriculture. What about just in the office? It seems like it's a fairly safe place to work, but you can still see some sorts of injuries.
Absolutely.
In an office situation.
If you're not sitting in an ergonomically correct position for a long period of time, then you can definitely have issues, from carpal tunnel to strains on your neck, strains on your back. You know, you can have a lot of different things that happen. I mean, a lot of people trip over a cord or a box and they have ankle injuries. So definitely we look at ergonomics, and we want to make sure that people are appropriately answering the telephone. You know, you don't want to be, you know, have the telephone resting on your shoulder, and then typing at the same time, because again, you can strain your neck.
What do you think, as we're sitting here at this table, we don't have a computer, but we all are on a computer. I'm on a computer a lot. What's the number one thing that we do wrong that might be creating strain in our wrists? You know, I'm right-handed.
Well,
so
a lot of computers, you know, they do sit at an angle this way, so then your hands are at this angle. So they have pads that you can put under to support the wrist area, so you're going to be more at a anatomically correct position versus being tilted this way.
Okay. And what about like screen distance, because you can also have eye strain?
Absolutely. And you know, it's recommended that, you know, every 2 to 3 hours you take a break from looking at that computer screen, because you know, obviously you've seen the computers that have the burn on the screen where they've been on too long. Your eyes kind of focus on that and have that issue as well. So, you know, just kind of stepping back. Most people that are at a computer for a long period of time, most of them wear eyeglasses, and it's not necessarily at the beginning of the day do they necessarily need them, but as their eyes get tired, they probably should put their glasses on, just to make sure that they're being, you know, focused on and helped.
So in this last minute or so, let's talk about prevention. I mean, we've got in some industry safety officers that are kind of helping workers with that, but in general, what can we do to prevent workplace injury?
Well, they're, you know, obviously using a lot of common sense and looking at looking around as you're working. That's one of the major things. And, you know, being aware of your environment is very, very key. We do some, you know, screenings after some people are employed before they actually start on the job, to ensure that they are safe to do what they need to do. If you've had major back surgery, you may not want to go and lift something that's 50 pounds every 3 minutes.
Right.
You know, or if you don't have very good vision, you may not want to be that person that needs to pick screws out of something to be, you know, something that has to happen. So we look at what their job descriptions are. We look at what kind of medical history they have. The other thing is, if we find that they have high blood pressure, if we find that they're having protein and sugar in their urine, if we find that they have issues, then we recommend treatment, and we can write prescriptions. We can do some safety initiatives. You know, we just had a stroke initiative at the hospital where people could come in and get screenings. They could get EKGs, they can get chest x-rays, they can get pulmonary function testing. We can look at a lot of different testing to help people prevent things. And so that is the main thing, because if we can prevent it before it happens, obviously that's a win-win for everyone.
It sure is. All right. Well, Tiffany, we're all out of time. Thanks.
Okay.
Thank you so much for coming by Being Well and talking to us about workplace safety.
Thanks.
Thanks.
More than 1 out of 4 Americans has high blood pressure. For millions of them, a little-known condition is to blame. The good news? The right treatment may cure their hypertension permanently and even save their life. Here's Dennis Doda for the Mayo Clinic News Network.
For 10 years, Jim Johnson struggled to control his high blood pressure.
Yeah, I'd be on various medications for that, and doctor would always say, oh, you got to lose some weight, and you got to do this, you got to do that.
Other than fatigue, Jim had no symptoms. But last year, when his heart rate became dangerously slow, blood tests found severely depressed potassium and elevated aldosterone levels. A CT scan revealed something else.
In your right adrenal gland, we see some very small bumps or tiny nodules.
Mayo Clinic endocrinologist William Young says the nodules were creating a condition responsible for 5 to 10% of all high blood pressure cases.
Primary aldosteronism means where one or both of the adrenal glands produce too much of a natural hormone, which is called aldosterone. So in the United States, that comes out to 3.4 to 6.8 million individuals.
A simple blood test can confirm excess aldosterone levels, after which a visit to a vascular radiologist may be in order.
Once again, sir, just stop your breathing right there. Hold your breath.
Mayo Clinic's Dr. James Andrews says his job is to determine if the problem flows from the left or right adrenal, or both. With a procedure called AVS, adrenal vein sampling, he collects a small amount of blood from each side where the tiny glands sit atop the kidneys. If only one adrenal gland is producing excess aldosterone, the condition is often cured by removing it. The minimally invasive operation takes a little more than an hour. Although surgeons may have to work their way around the stomach, colon, pancreas, spleen, or liver, Dr. Jeffrey Thompson says it's relatively low risk, and patients generally bounce back very quickly.
Typically, they're out of the hospital the next day or at most 2 days later, and most of these patients are back to full normal activities within 10 to 14 days after the surgery.
Dr. Young says aldosteronism is the most common curable form of high blood pressure. For 1 out of 3 patients with this disorder, like Jim, finding and removing an adrenal nodule may be a lifesaver. Not only was Jim at risk for severe kidney damage, doctors told him his heart literally could have stopped.
Aldosterone turns out to be one of the most toxic hormones human beings make. And when this is made in excess, it can lead to renal failure and heart failure.
For the Mayo Clinic News Network, I'm Dennis Doda.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Being Well is also available online at our YouTube channel, youtube.com/WEIUTV. Just look for the Being Well playlist. Here you can view current as well as past episodes.